Running the practice involves really being involved in everything, all the running of the practice, from day-to-day management of the practice to clinical dentistry and surgery. Digital dentistry is really an innovation that's becoming more mainstream in the last 10 years or so, where we're using digital scanners instead of horrible mouthfuls of impression material. That means we can do a lot more that we couldn't do before, such as CAD/CAM manufacture of dental crowns, 3D printing of surgical guides for implant work. Euston Place is, I think, a really great practice because it's been one of the most established practices in the country, having been a dental practice since around 1867, so it's a very old dental practice. That said, we have some of the most modern technology within the practice, things like CT scanners, 3D printers and digital scanners, so we're in a very old building that's been a dentist for a very long time, but we've got state-of-the-art dentistry going on.
When it comes to anyone looking to work at Euston Place, generally we would want them to have a really, obviously, interest and passion in dentistry. Ultimately, they're looking to try and improve the oral health of our patients, so they have to have a real strong passion for managing patients' oral health. I really like, as a recruiter, them to have prior knowledge of the site. Obviously not everyone's going to know the ins and outs of the practice, but just by doing a little bit of research beforehand, looking at our website, looking at our social media pages, it really allows them to present a case that they want to join us as a practice rather than just interviewing for a number of roles. So our apprentices start from the age of 16. We don't need any prior experience in dentistry, but it is good for them to have communication skills and to show a level of maturity coming into that apprenticeship role, because I said they are asked to communicate with patients and with our dental team. So the apprenticeship we actually advertise via the college, or Warwickshire College, so they put job adverts out for apprenticeships, and then we work closely with Warwickshire College and they will send us suitable candidates for the role, which we will then interview that candidate to make sure they obviously are a good fit for the apprenticeship role here. And with our nurses, we would like them to either have completed their dental nursing qualification that they do as a college qualification or as part of an apprenticeship scheme. In terms of competencies for a nurse, they have to be extremely good at multitasking and have a really strong work ethic.
So my name's Sian Mulligan. I'm a dentist, a general dentist, but I do lots of orthodontics as well. So orthodontics is braces for children and adults. It's a really highly rewarding profession. I absolutely love it. The interaction with patients and staff, it's really great, just looking after patients and teaching them and sort of educating them on their well-being and their oral health and just looking after their smiles. It's really rewarding. At school, I really enjoyed the sciences, so that sort of naturally sort of pushed me into doing sort of science A-levels, and then looking at universities. Dentistry was one of the careers that really sort of stood out because it was a vocational career. So you go to university, it's hard work, it's 5 years working hard, but then you know at the end of your actual time at university that you're going to have a profession and go straight into a job. So that was quite appealing, really. So the nurse is fundamental to the dentist because we sort of just work as a team. So really the patient isn't just coming to see the dentist. I wouldn't be able to work without my nurse. So they would actually prepare everything. So the whole room, the instruments, everything is cleaned and looked after. And then the nurse actually works very closely with the dentist, so helping to look after the patient. And dentistry is sort of the art and the science side, and now the technology side. So it does cover a wide range of bases. It's not just looking at teeth, it's all the science, but it's the emotional side of looking after patients.
I enjoy helping patients. That is my main role. So whether that's helping them improve their health or helping them improve the cosmetic look of their teeth, which means that patients who have hidden their smile for years suddenly want to wear lipstick and smile at everybody, things like that make a big impact on patients' health as well as their mental health. And that's a very rewarding aspect of my job. I always assumed I would go down a medicine route, but having had a job as a dental receptionist fall into my lap as such, it opened up a different opportunity to help patients with their health. My role started as a dental receptionist, and then it became a trainee or an apprentice type dental nursing role came available, so I moved on to that because I was interested in doing something clinical. I was missing that medicine side and medical side of work. And so I did that and achieved my dental nursing qualifications with that. I also did sedation for dental nursing, as well as radiography and a few other add-on courses as a dental nurse before moving on to doing management with the dental nurse. And then from there, I was able to move on and apply for university and go down that route to become a clinician in my own right.
So when I left school, I did a MVQ level 3 in hairdressing, and then I decided that I wanted to go into dentistry, where I then joined Warwickshire College to do an apprenticeship. So we help the dentist and hygienist set up the surgery to help the procedure run smoothly. We also help by providing comfort to the patient, especially anxious patients. We help write clinical notes and help set up X-ray machines just to improve the efficiency of the procedure. So since finishing my apprenticeship, I've become a qualified dental nurse and have done different courses such as implant nursing, microscope dentistry, and I've been promoted to clinical lead nurse. I'm just about to start my radiography training, and then going forward, I'll probably do more courses and help train other nurses further.
I wanted to become a dental nurse because I enjoy looking after people and helping people and being able to make anxious people calmer. When I finished school, I wanted to look at an apprenticeship because I like learning on the job rather than just all paper, so an apprenticeship was perfect for that. I've looked at many pathways with dental nursing because you can do a lot of university courses with the level 3 MVQ, so you can do hygiene, therapy and many other dental routes, but I'm thinking of staying on as a dental nurse and keep progressing maybe to a practice manager role or something along the lines in a surgery setting, because I like the clinical side of the work as well. I looked at hospital nursing, caring, lots of different jobs, but when you look at dentistry, if you look in the job description, there's so many different opportunities that you can see. I would say that it's really good to do an apprenticeship, you earn money while you're learning. Dental nursing's really fun, I'd say, so just try it. If you don't enjoy it, then there's always different pathways you can take even once you have the experience in the job, whether you could decide to finish the apprenticeship and qualify or not. But I definitely say to try it. It's really fun and I love it.